we have Madam Sujata Sonik, a senior officer at the Indian Administrative Service, who currently serves as Additional Chief Secretary of the Department of General Administration, the Government of Maharashtra. She's a former Takemi Fellow in Global Health at the Harvard Chan School of Public Health, and she has 3 decades of public policy and governance experience in healthcare, finance, education, and disaster management at district, state, and federal levels. Welcome, Madam Sonik. And with that, let me invite Madam Sujata Sonik, who's going to give a perspective from the governance and as a pioneering person in incorporating various digital technologies in Maharashtra. It'll be great to get her thoughts on this. Over to you, Sujata ma'am.
Thank you so much, Priya, and to all the colleagues who have joined this discussion today from IDS as well as PHFI and colleagues from the startup community also. So I will begin by saying innovation disruption. What is the first thing that comes to our mind? Startups. So digital transformation of healthcare can be disruptive. Technologies such as the Internet of Things, virtual care, remote monitoring, artificial intelligence, etc., have proven potential to enhance health outcomes. During my recent assignment, when I was working in the Skill Development, Employment and Entrepreneurship Department of the Government of Maharashtra, I had an opportunity to work with many startups across different sectors. The pandemic, in fact, brought in its wake a need to collaborate, and each one of us was very keen to start contributing to the response. Many of these startups were winners of our Maharashtra State Startup Week, which we organize every year through the Maharashtra State Innovation Society, which is a body which is very unique to this state. It is part of the Department of Skill Development, Entrepreneurship and Employment, and it is a young body which is manned by qualified people who are very well connected to various stakeholders in the industry. So this society became the nodal agency under which we started to open up collaborations with different startups. And they played a very crucial role in our response to the pandemic. Let me give you a little bit of a window of where Maharashtra is poised in the country vis-a-vis other states. We often hear about Karnataka and other south states. I would like to just point out what are the statistics of Maharashtra. So we have around 14,800 startups which are registered in Maharashtra. Through the Department of Skill Development, we have been supporting 17 incubation centers. These are mostly co-located in the state's various universities. Maharashtra has emerged as a winner in 3 out of the 7 reform areas of startup rankings in India by the Department of Information and Technology, which is number 1, seeding innovation leaders, number 2, scaling innovation leaders, and number 3, awareness and outreach champions. So as you can see, a lot of our work has been around, connections with these young, startups who are keen to get into the healthcare sector. Interestingly, 5% of the total startups in Maharashtra are in the healthcare domain, which is not a bad number to start with. Mumbai has the 3rd largest startup base in India. Government policies and initiatives so far have been creating of a fintech policy in 2018. And also we have a startup policy also from 2018. So it was very fortunate that we had these policies in place before the onset of COVID-19 pandemic. The state startup ranking in 2020, Maharashtra has been termed as a leader, and we are very happy with that. And globally, in terms of growth, we have been signing a lot of agreements to bring to onboard other startups to work with us in the coming months. Now, patients want on-demand healthcare. Physicians and hospitals need big data insights. Medical wearable devices improve preventive medicine. Using AI as an enabler to provide personalized treatments and use of virtual reality to help doctors get better trainings. All of us have this on our wish list. How are we actually going to achieve it? That's the big million-dollar question. A special incentive scheme to support startups in telemedicine, digital health, and artificial intelligence through the Biotechnology Industry Research Assistance Council, also called as BIRAC, an enterprise run by the Department of Biotechnology, has been working exactly on those areas. Bharat has been supporting and promoting new biotechnology ventures under its Startup India and Make in India program. Perhaps you've heard about these terms. It has so far lent funding of over 21.28 billion, that is almost 280 million US dollars, to around 1,500 startups, enterprises, and small businesses. The council has also extended support to fledgling startups who, prior to the pandemic, were struggling with issues such as rising patient demands or aging populations, the increase of lifestyle diseases, and growing costs of delivering care. So some of these ailments which are plaguing our public health system were also the areas where we found that there was a lot of startup activity looking at gap areas and trying to reach those who have not been surfaced so far. These pressures had forced our healthcare providers to come up with new solutions like employing medical answering services to enhance the quality of healthcare services as well as lower their prices. However, the pandemic hit the world and introduced other challenges, exposed gaps and vulnerabilities in the healthcare space. Still, it presented new opportunities that have helped health tech startups to showcase their abilities and innovation. You just heard the experience from two. There are so many more in this sector, but we don't have time to go into all of that. The COVID-19 pandemic is expected to have lasting impacts on the traditional method of doing business in the post-pandemic era. And that's where I feel, as a government, we need to also become smart. Everything around us is becoming smart. We also need to become smart. And how do we do that? We have to bring on board those groups and companies who are interested in partnering and doing collaboration. A study by Zeng et al. 2020 reported that as infectious COVID-19 persists, contactless services using advanced technologies are likely to infiltrate people's daily lives, which means we can only ignore this at our own peril. It is expected that the current growth trajectory of telemedicine will continue in the post-pandemic era as patients have generally been satisfied with remote healthcare services without face-to-face encounters with their doctors. Everyone has found value in this, and we need to build on these opportunities that have now emerged. The pandemic will not be the last one. New ones will surely appear in the future. In fact, there's a study by Jones 2020 that says that healthcare industry, especially public health, must not only manage the current pandemic well, but also be prepared for future pandemics that will most likely disrupt everything in a greater magnitude than the current one. Which means what? Already there's disruption around us. We have to partner with startups. And that is what we have tried very successfully. And I'll be happy to discuss more of that in detail as we progress into this discussion.